La, where's the chat? Where's the chat? Hello, good evening. Hello, Nimby. Si Popmaster, Abangers. Hello. Hello, Henpai. Bentix, hello. Kyosa, hello. Jessie, hello. Jeppe, hello. Okay, I need to drink. Oh, there we go. Chat's coming out now. Buhay ka pa sa cold brew. You know what? Actually, that cold brew, I only drank 1/4 of that cup, and I didn't like it anymore. I can't drink it anymore. Not only does it taste disgusting, but I think I started. It has, because I looked it up. Cold brew has way more caffeine content than Monster Energy, so I had to stop. It has more caffeine content than Monster Energy, so I had to stop drinking it. Not only was it disgusting as hell, I think I was starting to palpitate, so I had to stop. Ito, but cold brew binili ba? I'm only going with what chat tells me to buy. I don't know. No one was really suggesting one certain thing. It was all different, and then someone just said cold brew, and they said yes, so I went with that. Because I don't know I know nothing about coffee. I don't drink coffee, so I don't know anything about coffee. It's like last time I had coffee as a. It's like last time I had coffee as a goal before. The first time, someone suggested I think it was Americano. It was Americano. It was disgusting as well. I couldn't finish it either. It was gross. Hello, Amano. Hello, hello. Who suggested that? Ayan, no, si Rain. I can't. Yeah, I think it was gross. It was. I couldn't finish it. I had to throw it out because that was our regular cup, and 1/4 of it. 1/4. I started to not feel very comfortable, so I had to stop. Coffee's supposed to be bitter. It's nasty. It's disgusting. I don't care what other like stuff you place in it to make the nastiness go away. It is still there, just like alcohol. I think you're actually supposed to cut it with ice and water. It had ice already. It came from Coffee Bean. I just tried Monster this morning. The cafe. Yeah, Monster has less caffeine than cold brew. I looked it up. I was like, what the hell? This thing has 200. This thing has 200 something milligrams of caffeine in a 16-ounce cup. Are you kidding me? And I was like, oh, this is way stronger than Monster. I guess di ba din kaya pure matcha? No, matcha. There is a right. Ano yan? May tamang timpla yung matcha. You can't just drink matcha on its own. There is a right mixture for matcha. All the other matcha I drank was shit, but there is a way to like mix matcha, or you know, titimpla mo yung matcha and it tastes better. I thought Doc could tolerate since he's drinking Monster. Monster taste. The difference is, Rainer, Monster tastes good. Coffee doesn't. Coffee tastes like Satan's diarrhea. Okay. You should start with sweeter blend stuff. Yeah, if only people were actually choosing that, you know, the sweeter blends. People want the worst for me. The heck, you guys? I was like asking on the chat, yes, like the last stream, what do I buy? And then I was looking through the things. I was actually listing, going through Grab and listing the coffees, and then cold brew was the only one suggested. No one even, like, I went through the Twitter and there was so many different, like, there was not one choice that had multiple, you know, votes. It was just one coffee different from another. And then when I streamed yesterday, I asked again, and I even opened up the Grab app and then went through different coffee shops and then listed different coffees and then just said cold brew. Matcha tastes grassy. Yeah, matcha basically tastes like grass. That's what it's, grass juice. Depends on the monster. Some of them taste like chemicals. Chemicals taste better than freaking Satan's diarrhea. Outside of that, if you still want to give coffee a chance, try it. No, I don't like coffee. You guys just made me hate coffee even more. No, there's no chance. How dare I love matcha? Matcha's okay if it's made right. Otherwise, it just tastes like grass. It's like grass and water. That's what matcha is. What you gotta do is just get grass outside, crush it in a mortar and pestle, and then mix water. That's your matcha. So, anyway, it is day 4 of the Donothon. It's day 4 of the Donothon, and we have made, for the 4 days, we have made, $1,162 US, as you can see up here on the bar. Yeah, hopefully we can get more. Actually, this is really good for first 4 days. It's not bad. Hopefully we can get more. So guys, just share the Donathon. Share the event around. Share it around people you know, because we need more people to help out patients. We need more people to help out. Oh, and Watsy also emailed me. I haven't answered them yet though. Wait, they emailed me. They emailed me actually, like, recently, and they said they were actually amazed with how much support the Donathon has. Yeah, they were amazed with so far the support we've gotten so far. I haven't replied to them. I have to reply to them. So yeah, this is a good sign. Oh, they told me to register something. I'll do this later. Anyway, I'll answer them later. So yeah, today we're going to talk about for this stream. So this is gonna be a medical. Oh wait, you know what? I forgot to tweet that I'm streaming. Let's go tweet. I am live right now. I forgot to tweet that. La 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 la. Let's go live right now. I forgot to tweet this. live now on YouTube. There we go. Okay. Alright. Okay, so for this stream, we're going to talk about common surgical cases in the Philippines. Okay, mostly we'll talk about the major ones. And actually, it's more of the surgical cases of the patients in the Wsfp list. That's what we're gonna go with. We're gonna go with that. So, where is it? Oh, we're gonna go with the Wsfp list. Dapat pala tahol na lang, di na lang kape. Alright, so let's go through this list right here. We'll go through some of these patients and then we'll just talk about their diseases. Okay? So, let's see. Let's go with, what's this one? Let's go with Jesusa. Updog. Evening, Doug. Hello, good evening. Jesusa. So this is one of the patients that needs help. Oh, what's this? Jesusa has always been a hard... Yo, her thing has been ongoing since May. Alright. Jesusa has always been a hardworking, independent woman. She finds fulfillment extra income in sewing despite her aging vision. She lost her husband. Oh, she lost her husband during COVID-19 pandemic 4 years ago. Oh no. Since then, she has taken more responsibilities and she acts as primary caregiver of her grandchildren. In 2019, she noticed a lump on her right arm. It was small and painless, but gradually got bigger, bringing pain and discomfort. She was experiencing numbness on her right hand and occasional pain on her shoulder, especially close to the She was referred to our medical partner, World Surgical Foundation, where she was diagnosed with a lipoma. Though the condition... Oh, she has a lipoma, so it's a big one. Huh. On her right lipoma. Okay, we can talk about lipoma. Lipoma is... Okay, let's talk about a lipoma. Lipoma is a tumor. It's actually non-cancerous, but lipoma is a tumor of the fatty tissue. It's a tumor of the fatty tissue, and it grows randomly, pretty much. It can be small. It is small, but it can also grow larger. It can get bigger, actually, and it can become gigantic. All right, it's gonna be like if you would feel a lipoma, it's usually soft, like a soft bulging mass on any part of your body. It's really soft and squishy. It's actually really soft and squishy. A lipoma, it's soft and squishy. And then, actually soft and squishy is a good sign that it's not cancerous, because cancerous is usually hard and firm and non-movable. So, but see, even if lipoma is benign, It's a benign condition. It can turn cancerous. It can become... It can morph into a cancerous lesion, a liposarcoma, and that, you know, instead of just removing it, you have to do more. Because, you know, cancer, you do more. So, lipoma is like... If you're gonna look at a lipoma, like out from once you have a surgery done and you look at a lipoma, it looks like a freak. It's yellow and lobulated. Wait, I will show you what a lipoma looks like. Lipoma. Oh, here we go. Let's look at this. Okay, look at this. Here we go. Since examples of sun, look at these bulges. Okay, this is an example of what it might look like on your skin. It's just bulging out like this. And then, there we go. Here we go. This is a nice looking image. It's just yellow fat. Oh, and it looks like this too. This is what it looks like. It's like yellow. It's like a yellow blob right here. This is what lipoma looks like when you remove it. When you surgically remove it, it looks like a yellow blob. That's what it looks like. See, look at this. Look at this perfect yellow blob. Nasisip-sip pa ba ng straw? Of course not. It's fat, bro. It's like a big fatty tissue. Look at this. Lipoma. Okay, it can occur in any part of your body that has fat. Like, a lot of people develop this without even knowing they develop it. I think I have one also. I think I have one, actually. No, wait. I did have one. I had a lipoma, small one, on my right foot, actually. So weird. I noticed it, like, years ago. Like, there was, like, a slight bulge on my right... No, not my right foot. My right ankle. And then I had it removed, and it was like freaking weird fat. It was like a flat, fatty tissue. It was weird. And I think I have another one on my hip. I'm looking at my foot right now. I can't find my scar. Okay, I can't find the scar. Oh my god, I think my scar faded. Oh, there it is. I found it. My scar faded. My scar is barely seen on my ankle. I can see it's just like a little line. Ooh. Anyway, yeah. I had one in my neck that was removed surgically. Yeah, it's removed surgically. Bro, my scar is gone. I thought I remember having a really big, not really big, but like really, you can really see the scar. It's gone. Anyway. Did you remove it yourself? Of course not. I actually had a plastic surgeon remove it. A plastic surgeon I know removed it. Yeah. I literally can't see the scar anymore. It's so faded. I'm actually looking for it right now. Yeah, I saw it a while ago and then it's gone. It disappeared. Yeah, it's really faded. Anyway, I had one of those in my neck. It was removed surgically. Yeah, it's removed surgically. Had one on my hand. It didn't hurt, but it was annoying whenever I closed my hand. It was small but annoying. Did it You had it. Did you have it removed, Avery? Did you have that removed? Is it life-threatening? No, it's not. It's benign. You just like all you gotta do is just like, for example, this one, you just cut and then remove it and then suture the skin back. That's what a lipoma is. It can grow. It can be small like this or like this, like tiny, but it could also get big like this. See, this guy has a humpback. It can go. It can get pretty large, like really large, if it keeps growing. So yeah. She needs $1,479 US for this? Oh, I know why, because it's probably huge. It's big. This is expensive. Wow. Mahal na. Wait, hold on. That is expensive, eh? Hold on. Okay. $1,479 US to have that moved. I'm guessing it's large because I know that small what do you call this? Small lumps that are removed are like cheaper, but if we're gonna go for larger ones, they get more expensive the bigger they are because it gets a little more complicated to remove. Anyway. Go to the next picture. Eileen is a 54-year-old mother of children from the Philippines. She used to work at a local eatery, however, due to her illness, was unable to work for the past 2 weeks. She was registered at June 5. Family's main source of income is now her husband's pension, which is insufficient to cover their daily expenses. Okay, so what's her troubling symptom? Neck pain, fatigue, difficulty sleeping. Ooh, sounds like a neck. Aha! It is. It's a goiter. It's a thyroid problem. So she needs a thyroidectomy, where they will remove all or part of her thyroid gland. It's $935. It's actually cheaper to do a thyroidectomy. Okay. I think I've talked about thyroids. I've talked about thyroid before on my stream, on my previous stream. I remember talking about thyroid before. So, multinodular non-toxic goiter is basically when you have nodules in your thyroid gland. It doesn't mean that it's cancerous. It actually depends on the final biopsy of the thyroid. Because sometimes you can have multinodular non-toxic goiter, where you have multiple masses in your thyroid with multiple nodules, but then sometimes there's like a small portion of the thyroid or one of those nodules turn out to be cancerous. It's possible. So yeah. Usually if the thyroid has nodules on both sides. Oh! And then thank you for the 10. Thank you for your dono. Yay, we got one. Thank you. So anyway, as I was saying, even if you have if you have nodules on both lobes, because a thyroid looks like it's a butterfly-looking organ. I'll show you what a thyroid looks like. Like, I know I talked about thyroid, especially thyroid cancer. Especially, another VTuber I know had thyroid cancer. It's Ratanak. We talked to, I think I had a stream with him. It was a medical education collab stream. Here we go. So this is what the thyroid looks like. It's on your neck. It's over here. See that? It looks like a little butterfly in your neck. There we go. That's the thyroid gland. And if you have multinodular non-toxic goiter, then you're gonna have, this thyroid is gonna have like little nodules. Little nodules on it. Little or big. And sometimes they can contain a cancerous cancer. Do they have minimally invasive surgeries for? Yes, they do. It's endoscopic, but the thing about that is it's fairly new. It's fairly new. I don't know how to do it. I don't do it. And honestly, in my opinion, okay, I don't think you need it. Of course, but I think the trend now is minimally invasive, so it's up to you if you want to learn how to do endoscopic thyroidectomy. Go ahead. But, it's very technical. It's very technical. It's not like if a total thyroidectomy open traditional way would take 3 hours, an endoscopic thyroidectomy would take a lot longer because it's a fairly new procedure and you got a lot of tunneling to do. Like you pass by the mouth, the under the lip, I mean, and then you have to tunnel all the way to the neck. Happy Oshidino. Hello, Minukalu. So anyway, yeah. Usually, if the nodules are located on one lobe, because you have 2 lobes, or well, 3, or no, 2 lobes, right and left lobe, and then you have the middle one, the middle portion of the thyroid is called the isthmus. So we have 3 parts. If there's only nodules on one side, then you only take out one side. But if it's everywhere, just take out the whole thyroid. But the thing is, once you remove the entire thyroid, you're gonna be on meds, maintenance meds, because the thyroid is a very important organ. It produces the thyroid hormones, and if you don't have the thyroid, then you can't produce those hormones. So you're going to be on maintenance medications. Okay. So and if you do have multinodular non-toxic goiter, maybe the first time, if it's still small, you can probably let it pass. But if sometimes goiter can get really big. Can get really big, and it can be very it can affect how you look, of course, because you're gonna have a bulging neck, and sometimes it can get too big that you can't eat properly, like you can't swallow, you can't breathe properly, and those ones, if they are symptomatic like that, then you really need to have it removed. Look, diba may virtual training minimally invasive? Yes, there is. Alright, so yeah. Oh, this is a young one. Mary Joy. Single mother of 3 children. Numbness in the lower back and vomiting. More pronounced following COVID pandemic. Oh. Desert Punk, thank you for the sub. Thank you. Oh, she has gallstones. Okay, she's advised to undergo polycystectomy. Here we go. This one is the one of the most common if not the most common surgery case done here in the Philippines. Like, almost, I don't know, a lot of people and their mothers have gallstones. A lot of people get gallstones. So, cholecystectomy is the term used when you say removal of the gallbladder. And usually, the gold standard is to do it laparoscopically. So I've talked about this also in my one of my medical education streams. I think I had one. I have a previous stream before. I call that medical education stream where I talked about the laparoscopical. I talked about the cholecystectomy. And the one I collaborated with was Sir Wheatbread, because he had his gallbladder removed. So in a laparoscopic cholecystectomy, you only need like 3 to 4 incisions, really small, and then all you gotta do is have like, see, these little these long instruments go inside, and then all you gotta do is just like remove the gallbladder. Here's an actual image over here. Here we go. And then this is compared to like traditional open. This one is traditional open, where you really talagang biyakte. You're really gonna slash open the right upper part of the abdomen and then look for the gallbladder removal. Compared to this, where you just have 4 small, tiny incisions. Is gallstone an old people complication or hereditary? It is more. It depends on the type of stone, but it is more on the diet. You eat a lot of fatty foods, have high cholesterol, you're gonna get cholesterol stones in your gallbladder. Sometimes it can be genetic, especially Asians. Asians usually have pigment stones, which are black stones. Westerners or Caucasians usually have cholesterol stones. But then in the Philippines, here in the Philippines, mahilig tayo sa matataba, di ba? Mahilig tayo sa bagnet. Mahilig tayo sa liempo, sisig, chicharon, lechon, adobo. So we Filipinos also get cholesterol stones. We have a lot of fat in our food, so we also get cholesterol stones. Fried chicken. So yeah. But she's pretty young though. She's only 27. Anyway. Rosalia is a 71-year-old widow from the Philippines. Lives with her granddaughter. Passion for gardening, cultivating vegetables. Okay. Lump on her right breast. Okay, we got. Oh, that reminds me. Excuse me, I burped. That reminds me. October last month was breast cancer awareness month. Anyway, she has a lump in her right breast, and then she is diagnosed with cancer. She needs to she has cancer of the breast, yo. 990. Bro. Oh, this is one of the patients that needs help right away. She needs... 548. She is one of those who urgently needs help. You know, if I were to, I would target the cancer patients first. Anyway, breast cancer. Breast cancer is very complicated. I actually don't like breast. Breast is the most, what do you call this? Breast is the most, or no, not the most, the least favorite of mine. I actually don't like breast when it comes to surgery, because breast, even though it's just an organ, a mammary gland, it's just like, it sounds like it's so simple, but actually breast is very complicated, or it got complicated over the years. Like, so now when we talk about breast cancer, I think I also have a stream about this one before. Last year I had a breast stream, because I think I also did like a Donothon for Breast Cancer Awareness Month last year, and we donated the funds to one of the breast centers. Anyway, breast cancer. So there are many different ways to treat breast cancer. So if the breast cancer is small enough, they can just undergo an excision, like just remove the tumor. Remove the tumor, and then you have to assess the lymph nodes in the armpits or the axillary lymph nodes. And if a sample of the axillary lymph node is negative for tumor, then you don't need to touch those. Okay? But if the axillary lymph node has tumor, then we have to remove those lymph nodes in the axilla. So if you're just gonna remove the lump and not the entire breast, it's called breast conservation therapy. So it's just removal of the tumor itself, radiation with the biopsy of the lymph nodes, and then radiation therapy. But if we're gonna remove the entire breast, especially in cases where the tumor is really large, it's called a mastectomy, or a modified radical mastectomy if you're gonna remove the lymph nodes. So the thing, what makes breast cancer harder each year is because they are very active at breast surgeons are very active at researching about breasts. Like every year there's something new. Every year or not even every year, probably numerous times a year, there is some new treatment, some new protocol, some new surgery. Like I know recently they would like have different treatments for different stages, and then they would have different, even when it comes to hormone therapies and chemotherapies, like, and the radiation therapies, they have different managements each time. So that's why breast is my least favorite, because they keep changing. They keep changing, and they keep morbing. They keep morbing, man. Oh, hello, Tree Bobber. I'm almost the same age as Mary Joy. I have yet to have a girlfriend while she has 3 children. She's a single mother. Okay. So many approaches. Yeah, breast cancer do be like that. It's crazy. Like, even the process of diagnosing breast cancer is not as easy. Because before, it used to be very simple. A patient approaches you and they have a lump on their breast. So you do a physical, you take their history, do a physical exam. You request for a sonomammogram and a mammogram depending on their age. Like, sonomammogram is like ultrasound of the breast, and then a mammogram if they're of age, like 45, you request for a mammogram. And then if the imaging requested, let's say the ultrasound requested says, yeah, the breast, there's a tumor, there's a mass, and there's a mass in the breast, measuring yada yada yada, and it is suspicious for malignancy. They have a scoring for that. They have like it's called BI-RADS. BI-RADS 0 to 6. So let's say, I think if it's suspicious, if it's suspicious for malignancy, it's usually a BI-RADS 4. So once the imaging says it's suspicious for malignancy, you have to take a biopsy. And the biopsy for a breast mass is called a core needle biopsy, where they just get a sample of the tumor with a large needle. It's like they use a core gun. It's called a core gun. It's like a needle gun. And they get a sample of the breast tumor and then send it to the pathologist. And if it is cancer, you just operate. Remove the cancer. Mastectomy, modified radical mastectomy. And then chemotherapy. And then later on, like after some years, they evolved. The management evolved. Like, okay, now that we are aiming for minimal, saving the breast. If the tumor, we can do breast conservation therapy. So all you gotta do is like, just remove the tumor and then take a sample of the lymph nodes in the armpit. Do a frozen section, and if it's like positive, then you have to remove all the lymph nodes there. If it's negative, you don't need to touch it, and then do radiotherapy. And then chemo after. And then after some time, they made a new discovery. Like, oh, we gotta add another way to treat this. Like, we gotta now, instead of just taking a biopsy of the breast tumor, we gotta find out the hormonal response of the tumor. So aside from getting a tissue biopsy of the tumor, you have to send that same tissue for immunohistochemical staining. And then they'll tell you if it's ER/PR positive or negative, or HER2, you know, all that. Like if it's receptive to hormone therapy or not, or HER2 therapy or not. So then they have, okay, we can do after removing the tumor, we can do hormone therapy, and if it's positive, we'll do that. And then later on they discovered, oh wait, we can also do something. You know, every time there's always something new. It's always like that. There's always changes. So that's how crazy breast cancer is. And that's why I don't like it. I don't like breast cancer. So any questions so far, chat? With what we did talk about? I wish it's the same for neurosurgery. What do you mean you wish it's the same for you? You want neurosurgery to keep changing? Anyway, if there are no questions, let's see. I think we're going to Leonora. Leonora, housewife from the Philippines. Receives small pension. Lump on her neck. Okay, she has thyroid? Diagnosed with a mass on her thyroid, and she will need surgery to prevent her disease. Thyroidectomy. Okay. So it didn't say what exactly her thyroid lesion is, but I'm gonna assume it's goiter. Anyway, we talked about goiter a while ago. Ito, conception. A 52-year-old teacher, breadwinner, having been a single parent for 17 years. One of her siblings, okay, wait, she also cares for 3 elderly siblings. One of her siblings has had a leg amputated and can no longer work, while another is bedridden. Oh my god, okay. Their eldest brother serves as the caregiver for her 2 ailing siblings. None of them receive any form of pension or financial assistance. Oh. Okay. 4 months ago, she began experiencing troubling symptoms. Severe abdominal pain radiating to her back. Oh, this is gallstones. Persistent vomiting and increasing difficulty eating. This is oh wait, her abdomen is getting larger. Okay, however, the past 4 months, wait a second, her past 4 months she lost weight. Wait, no, it's not gallstones. From 77 to 54. No, that is not gallstones, is it? No, she lost weight. That's more than just gallstones. Oh wait, she has gallstones. Okay. Her symptoms are caused by gallstones. Okay. Oh, so it is gallstones. Why'd she lose weight though? What if it's more than just gallstones? Oh, maybe it's because she stopped eating. I guess that's why. Because every time she ate, the gallstones would get the gallstones triggered. That's probably why. Yeah, I think she got scared of eating because of her gallstones. Yeah, I had patients like this. Where they, there's a lot of patients. I get a lot of patients with gallstones, okay? And, not all of them will go for surgery. Because, you know, a lot of patients are scared of surgery. They're scared of going under the knife. I've had one patient who said he was prepared for surgery, but he didn't follow up with me. There are some patients I talk to, even online. Let's say online. That have gallstones, but they don't want to have surgery done. They're scared. And they always look for alternatives, like flushing or taking meds. Here's the thing about those. If you know someone who has gallstones, okay, tell them to get surgery. Especially if they're having symptoms, guys. They are scared of having surgery, and then they look around for alternatives like herbal meds or flushing or whatever that is. I don't know what flushing was, but someone showed, I think one of my patients showed me that she saw something on TikTok. She said she saw something on TikTok and it was like flushing. I'm like, what? And I was like, what's flushing? I'm like, what did you see on TikTok? And she found it and showed it to me. And I was like, what the heck is this? I'm like, no, that doesn't do anything. Please don't trust anything. Don't trust everything you see on TikTok, lady. I'm like, no. And there's also medicine. So the thing about medicine is it doesn't work on all gallstones. Can't believe people would be scared of you're so safe. So it's not me they're scared of, it's a surgery. Scared of surgery and the cost when it happens, I guess. They're scared of surgery and they don't have the funds. And you know, since I started private practice this year, because I would do, past 5 years I had residency, right? I was taking my residency, and I know in my past 5 years of residency, I know a lot of people can't afford surgery. I mean, just for materials, they can't afford it. But then here in my private practice, the scope, like when I was in residency, I would see like, oh, these people can't afford treatment. So, and it's only, but when I started private practice, it's like the realization is on a wider scale, like even wider than what I realized when I was in residency. Because this time I'm doing private practice, and in private practice I started to see what the actual cost of a surgery is in private hospitals. I'm starting to see the actual cost, and I would be like, what? Like, laparoscopic cholecystectomy, okay? In a government hospital. Because I know the bills of some patients. Okay, so sometimes I look at their bills, and their bills are like, let's say, smaller, like 30K. Sometimes they just cash out 30K, 40K, minsan mas mababa pa, 20K, 30K, 30,000 pesos, 40,000 pesos. Sometimes it's lower, 20,000 or even lower. Okay? In government hospitals. When I started private practice, that's when I was like surprised, because I would ask like the hospital where I'm working at, okay, can you give me the most common prices of these procedures so I know what to tell my patients? And then I receive a list, and I'm like, what the this is like double! Laparoscopic cholecystectomy, what? 140,000 pesos? Like, what the hell? 140,000 pesos? And then I find out, like, what? This other hospital charges 200,000 pesos for a laparoscopic cholecystectomy? What? I was like, yo, what is that? Oh, mahal! I was taken aback. Like, what? I'm like, why is it so, like, is it that expensive? And then I understand, okay, this is why everybody needs an HMO. And so I'm like, if you can get an HMO, guys, get an HMO. I'm telling you guys right now, chat. If you can apply for an HMO, get an HMO. The HMO is gonna help you a lot to cut the cost. So aside from PhilHealth, HMO is gonna help you a lot. I'm glad we have PhilHealth. Okay, here's the thing with PhilHealth. Okay, here's the thing with PhilHealth. PhilHealth, okay, let's say in laparoscopic cholecystectomy or laparoscopic removal of gallbladder, okay? If in a private hospital, let's say you're in one of the best private hospitals in the Philippines, in Manila, in Metro Manila, kunwari, St. Lucian or whatever, and the cost is freaking 200,000 pesos for a laparoscopic cholecystectomy. If you're just gonna rely on PhilHealth, as far as I know, will cover only around 60,000 pesos. PhilHealth will only cover total around 60,000 pesos. And it's divided, like, out of the 60,000 pesos, siguro mga 40,000 pesos. 40,000 pesos is gonna be covering the hospital bill. And then the other 20,000 pesos is gonna be covering the professional fee of the surgeon and the anesthesiologist. So if your total bill is 200,000 pesos, and then you have PhilHealth, you're just gonna have, that means minus 60, so you still have to pay 140,000 pesos. Right? And so if you don't have an HMO, you're gonna have to cash out 140,000 pesos, basically. And that's still expensive, right? That's why I'm telling you guys, get an HMO. Get an HMO. If you can, get it, because it will help reduce the costs. Depending on, I think it depends on your package of the it depends on the package deal of the HMO. So it depends on the package. It can reduce the cost by a large margin, or it can reduce it by only a small margin. It really depends. Mas mura pa St. Peter. My mom's angiogram and angioplasty coverage was 520k. Oh my god. Yeah, but wait, that's angiogram and angioplasty? That's expensive. That's for the heart, right? Heart procedures are expensive as hell. Heart procedures are expensive as hell. So I would expect that much for a heart procedure. Those are expensive. But this is laparoscopic cholecystectomy, which is one of the most common surgeries done in the country. So, yeah. So actually, if you're going to, let's say you have gallstones, and then you don't want to go to a government hospital, because, you know, the thing with government hospitals, they are cheaper, definitely. Public hospitals, government hospitals, they are cheaper. Sure. 100% sure they are much cheaper. Much, much, much cheaper. You'll probably only be spending at least 5 digits in a government hospital. But the catch in the government hospital is that you're gonna have to wait a very, 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 very long time. That's how it is. They can say zero balance. Oh, we have zero balance billing. If you go to a malasakit center or zero balance billing, zero, you don't pay anything. Libreng surgery. And the catch is you're gonna wait freaking several months before you get operated on. That's how it is. Unfortunately, that's how it is. The only time you're actually gonna get operated on early is if you know somebody in the hospital. So yeah. Kasi may pila yun eh. Hello, Silicon. Hello. Yeah, so if that's why I advise some of my patients, like, if you're willing to wait, then go to a government hospital. If you really want cheap, or like zero balance billing, go to a government hospital. But you're gonna have to really wait it out. You have to wait. Pipila ka, and you're gonna have to wait. That's how it is. There's nothing you can do about it. The faster way, of course, is, you know, private. There are cheaper options. There are cheaper options for private, like laparoscopic cholecystectomy. Private packages. There are cheaper. There are some packages that are cheaper. You just have to look, and they can be less than 6 digits. It really depends. You really have to look. Like the thing with the packages, I think you can't use your HMO for those packages. I don't know. I think it depends. So sometimes there are like packages that are like 50,000 lang. Just shell out 50,000 and then you can undergo a laparoscopic cholecystectomy. That's actually those 50,000, those 5-digit deals are actually good because that is cheap. That is dirt cheap already for like For like a non-government thing. Non-government. Anyway. So yeah, next. Spinal lang tsaka papagagawa procedure. Doc, paano naman po pag neurosurgery, tumor resection, or spine tumor, magkano? Those are expensive. Very expensive. They could probably cost as much as the angioplasty. That's 500k. Probably like that. And as far as I know, neurosurgery, they are not covered by HMO, so you're gonna have to shell out that much. They're not covered by HMO. Okay, we got this one. Mary, 23-year-old woman, the Philippines. Her uncle works as a joyride driver while runs a small sari store, which supports their basic daily needs but does not generate enough income to cover unexpected medical costs, such as surgery. Okay. Recurrent intense abdominal pain. Oh, this is gallstones. Yeah, cholelithiasis, gallstones. Another gallstone case. Only emergency surgery like hematoma. As far as I know, as long as it's a neurology, neurosurgery, they're not covered by HMO. Maria is a mother of 3. Okay, what's her... Her youngest child is diagnosed with Down syndrome and is now undergoing therapy. Difficulty with bowel movements. Occasional bleeding. Frequent swelling. Oh, she has hemorrhoids. Okay. She is scheduled to undergo a hemorrhoidectomy on August 8. Wait, what? But she still hasn't... A portion of her treatment... Oh. Wait. If she's scheduled to... Did she undergo the treatment? She wasn't even funded yet. Oh, no, I don't think she was funded. Okay. She was scheduled but not funded yet. Okay. Okay, hemorrhoids. Let's talk about hemorrhoids. I think I also talked about hemorrhoids before. Hemorrhoids are annoying. Hemorrhoids are annoying. There are 2 types of hemorrhoids. So there's external and internal hemorrhoids. Let's look at some hemorrhoid pictures. Hemorrhoids. Hemorrhoid types. Alright, let's look at some hemorrhoid. Here we go. Hemorrhoid types. Here we go. Hemorrhoid types. Alright, we have internal and external hemorrhoids. So internal hemorrhoids is inside. Comes from the inside of your anus, where near the rectum. And an external hemorrhoids is like outside the anus. External hemorrhoids are the painful ones because of the skin. The lining of the hemorrhoid is stratified squamous epithelium, and there's a lot of nerve endings there. So that's why when you have bulging hemorrhoids here, it is painful. As opposed to internal hemorrhoids, which are coming from here, these are not painful unless they're all swollen. There is like less nerves or no nerve endings in this area. So in that patient's case, I don't know what kind of hemorrhoids she has, but she has hemorrhoids. It can be annoying because they can get swollen, they can hurt eventually, they can bleed. They just bleed and then they stop bleeding after a while. And these hemorrhoids are easily treatable medically or conservatively, but if they keep recurring or keep happening, or medications and conservative treatment doesn't work, then they'll need surgery for us. You have to remove the hemorrhoid. Okay. I also talked about this on my on one of my medical education streams. So hemorrhoids is actually pretty common, especially if you sit in the toilet way too long. Let's say you're trying to tumatae ka, uupo ka sa toilet, and then you're playing games on your phone while you're taking a dump. It's just or doom scrolling on Facebook, on Twitter, while you're sitting on your toilet. There, that causes hemorrhoids, guys. Even prolonged sitting can cause hemorrhoids. Eating spicy foods causes hemorrhoids. Okay. Doc, why are you cute and League of Legends Worlds Final? No! No! Kasalanan ni Doc, nagsistream siya habang nasa zero. Ibig sabihin may almoranas ka, Minokalo. Okay. Minokalo confirmed may almoranas. Minokalo confirmed may almoranas. Magpagamot ka na. Magpagamot ka na, Minokalo. Alright, let's see. Next. This one. Let's see what this lady. Licensed teacher. Unemployed for the past 6 years, focusing on her child's needs. Oh, she also has hemorrhoids. Mixed hemorrhoids. When you say mixed hemorrhoids, you have both internal and external hemorrhoids. Okay. She can't sleep at night because of the discomfort. Alright, so we got 2 hemorrhoid patients here. With this guy. Oh, he's a DJ. This guy's a DJ. Okay, he earns money through working as a DJ from 6 to 3. Ah. The nature of his work and financial obligations have prevented him taking leave as it should be required for treatment post-op. Severe back pain, which he describes as intense and unbearable. When the pain became severe, he was rushed to a nearby emergency facility. Despite medical advice, he was unable to undergo the recommended surgery at the time of diagnosis. Financial problems. Okay. Oh, okay, he has gallstones. So another gallstone patient. Oh, this guy, Axel. This guy's 18 years old. Medical condition has prevented him from continuing his studies and participating in sports. And he has also experienced bullying from peers. Oh. He's getting bullied? Oh. 7 years. Oh, he has a thyroid problem. He's young. Oh, he's young and he has a thyroid. He has goiter already. So he needs a thyroidectomy. Okay. How about this one? Lorna. Okay, Lorna has a lump on her leg. So it did not bother her. She ignored it. However, in time it grew bigger and started to cause discomfort, affecting her ability to perform duties as a teacher. Undergo mass excision. Oh. Wow, it's 1,000. I wonder if it's a lipoma. They didn't describe much about the mass on the leg. It could be a lipoma or it could be a cyst. I'm guessing probably a lipoma that got big, maybe. Alejandro, 57-year-old retired farmer. Okay. This is... He has a hernia. Inguinal hernia. A bulge in the groin caused by abdominal contents. Okay. Oh, okay. So, okay, let's talk about hernias. Inguinal hernias is the next one. Hernias is pretty common here too. Inguinal hernia. Lus. Oh my god, this is a lot of hernia. Okay. Do I have a hernia stream? I think I have a hernia. I have hernia. Do I have a hernia medical education stream? I think I do. Right? I actually don't remember. I think I do. Anyway. Inguinal hernia. So, you had one? Okay. Yeah, I don't remember anymore. I did so much medical education streams, I don't remember. Okay, inguinal hernia. So, inguinal hernia is you seeing it. Seeing it. Alright, so inguinal hernias are very common in children. So it's basically if you have a bulge in your... It's usually seen in men and in children. You would have a bulge in your inguinal area, which is yung singit mo. Here, like here, this one. Inguinal hernia, this area. Sometimes, if you're a dude, sometimes the hernia or the bulging can reach all the way until your scrotum. All the way to the scrotum. Okay. And, it can get complicated. Like, if the hernia is... Here we go. If the hernia is small, for example, a hernia, you would have... Usually it's fat or bowels that are bulging through the inguinal area, through the hernia. And if the hernia is too small or tight, it can get complicated. So what happens is sometimes the bowel would be strangulated. Naiipit yung bowel or naiipit yung fat, and sometimes the blood vessels involved, blood cannot pass through the vessels, and eventually if you wait long enough, if you don't operate on that right away, the part of the bowel or the fat where the blood is where the blood can't pass through, it's gonna die. It'll necrose. Like for example here, in this one, right in this image right here, this bowel here, the intestine, if it's just stuck there and the blood can't send oxygen to this part of the intestine, it's going to turn black and necrose and die, and that is bad. It can cause sepsis, and the patient can die from that. That's why hernia is very kind of delicate. You have to know when a hernia case, as surgeons, we have to know when a hernia case is an emergency or if it can be an elective surgery. So yeah. This can be also, even if it's like not an emergency, it can be very discomforting for the patient who has the hernia because it can get really big and reach the scrotum. It feels heavy. And then there's many different ways to operate on this on hernias. There's different techniques, but the most common one or the most effective one is when they put a mesh. So every time, if you know someone who has a hernia and they have a surgery done, usually they would put a mesh. It's like a net, a mosquito net. Okay, like a mosquito net that they put here so that it blocks the hernia. You close the hernia and then you put it reinforces. There we go. It reinforces the wall so that it doesn't reoccur. Hello, Shoprazal. Hello. I thought you were showing balls. No, I'm just showing hernia. So anyway, yeah, we were talking about hernia because this patient has a hernia. Hemostatic agent? No, a mesh is not a hemostatic agent. It's basically reinforcing the wall. All right, next. Oh, this is a kid. 3-year-old girl. Wait, what's her? She has speech impairment. Undergoing speech therapy. Oh, anorectal malformation, a congenital. She has a complete or partial intestinal block. What kind of anorectal malformation? She needs to undergo a series of procedures to eliminate bowel dysfunction, as her parents cannot afford the cost of diagnostic tests and surgeries. Oh. Anorectal. Okay, this one's a little more complicated, guys. Anorectal malformation. Okay. This is in the realm of pediatric surgery, and I am not adept at this, but let's see. I'm gonna Google some things. There's only a few things I know about anorectal malformation, or what I remember. Let's look for images. It's better if there's images. Anorectal malformation. Oh, this one. There's a little table here. Is there one with images? Wait. I had to hide it, sorry. Open link in the tab. Oh, no. Open image in the tab. Okay. Isn't there any representative images for this? Oh, here we go. This one. Image in the tab. Oh, it's so tiny. What? Here we go. There we go. Alright. Here we go. I found a table of classifications of anorectal malformation, and wow, there's a lot. Okay. Let's see. Level of anomaly, high, intermediate, low. For male. Anorectal agenesis. Okay. Anorectal agenesis. This means that you don't have an anus. Okay? The babies are born without an anus. There is no butthole. There is a slit for the butt, but there is no butthole. That is one anorectal malformation. And in that kind of patient, you have to create a butthole. Yeah. And there are two types, apparently. There's one with a rectoprostatic urethral fistula for men, or for boys, and a rectovaginal fistula for females. So when we say rectoprostatic urethral fistula for boys, it means their rectum is connected to their prostate. No, not their prostate. The rectum is connected to their urethra at the prostate level. So that means if they're gonna poop, they're gonna be pooping out of their penis. Same here with female. The rectum is connected to the vagina, so the poop comes out from their vagina. And then if there is no fistula or no connection, it's just literally but no butthole. Just without fistula. It's sealed. It's just closed off. That's anorectal agenesis. Like they don't have an anus at all. There is no anus. It's either you poop out another hole or you don't poop at all. But I'm glad I'm learning, but I'm also questioning if I wanted to learn this. You never know. These are congenital defects. Some babies are born this way and they need surgical correction. Rectal atresia. So rectal atresia, I'm guessing by the term. Oh wait, there's images right here. Oh, here we go. Look. Male rectobulbar fistula. Look at this. See this? The intestine is connected to the urethra, so when you poop, you're pooping out of your pee-pee. Same here. The fistula is at the prostate level, so you're pooping out of your pee-pee. Same here. Look at that. Different areas. There is, and this is in a female. This is the female. There's a perineal fistula where there's a tiny hole. There is a way out. It's not really at the butthole, but there's a tiny hole where the poop comes out. And that's the perineal fistula. Or here we go, the anocutaneous fistula. It's not exactly in the butthole, but it's like a small, tiny hole. Rectal atresia. Rectal atresia is like if the rectum is too small, as far as I know. Wait. Rectal atresia. It's better if I show. Is there one? Aha! Here we go. Where is the rectal? Oh, here we go, this one. So tiny. It's so tiny! It's so tiny! Might have to zoom in on this. Wait. Yeah, there we go. Okay. Rectal atresia, basically, part of the rectum is small, like this. It becomes narrow all of a sudden. It's connected to the outside, but to the anus, but it becomes narrow all of a sudden, and nothing can pass by. That's rectal atresia. So, yeah. There. Same thing. Look, a fistula through the urethra. It's just at different levels. Rectal vestibular fistula, rectal vaginal fistula. Anocutaneous fistula, so just the intestine is connected to the skin through a small, tiny hole, basically. That's anorectal malformation. So this kid has anorectal malformation. Right. This one. Leanne, strong pain on her backside. Okay, I'm guessing this is gallstones. Okay, polycystic gallstones. She has gallstones also. Apronel, getting tired of simple postures. Colloid adenomatous goiter. Oh, so she has a thyroidectomy. Colloid adenomatous goiter is kind of like multinodular goiter also. Basically almost the same. You just have to have the thyroid removed. So far, you guys have any questions? How you guys do when you guys absorbing all of this? Absorbing all this information. There's another kid here. Relearn about hernia again. Kaya pa ng brain. I think the rest are... Oh, we're almost at the end. Okay. Some of them got funded already. This guy has gallstones also, so it's the same. Gina has lumps on her breast. Oh, it doesn't say what. Oh, she needs a. Oh, it's cancer. She's 42. She has breast cancer. Okay, we talked about cancer. This kid, what does this kid have? Down syndrome. Oh, he has a colostomy. He went placed when he was only 3 days old. Wait. Oh, he had an imperforate anus. That's okay. Imperforate anus. Another pediatric surgery. Okay. Imperforate anus is when you... is self-explanatory. You don't have an anus. There's no butthole. You can't poop. So it's kind of like the anorectal. It's an anorectal malformation. You can't poop. There's no connection. Or there is a connection. Like you have an anus, but there's no hole. Oh, hi, Rat. Hello, Rat. How's the Jollibee? I heard you ate Jollibee. Did you enjoy your Jollibee? Have you become one with us? You have eaten a part of the Philippines. Amazing. You have eaten a part of the Philippines, my guy. The Chicken Joy was great. I get you guys. Yeah, Chicken Joy is good. I like it. I like Chicken Joy. Hello, Zero. Hello. Now I need to get adobo. Yeah. I wonder how the Viet Chicken Joy tastes. Yeah, if Rat enjoyed the Vietnamese Jollibee Chicken Joy, imagine if he tries the Chicken Joy here in the local Jollibee. Anyway, yeah, I think that's all of them, though. These other patients were funded. We got a lot of patients got funded, though. See, you just need to fund these guys, but I'm pretty sure there's more is gonna be added. Every now and then, there's always another patient added. Every now and then, there's a new patient added, so. All right, you guys have any questions? I think I overloaded your brains because you guys are like. I think I overloaded your brains, guys, because I'm like talking about different cases. How many of the patients? Yeah, there's a lot. And I'm pretty sure this is going to be added. They're gonna have more. There's gonna be more. Every now and then, so one patient gets funded and then another one is added. So it's like that. We were running out of patience. I do have a lump on the top of my Is this? I do have a lump on top of my inside balls. Or what? Maybe the lump you're feeling on your balls is your balls. Get it checked. Yeah, you should get it checked. Oh, here. Hey, wait. I found something. Wait, let's go back here. We can look at... Okay, we can look at patients from other countries. There's actually a lot more. Look at this. This one guy from Malawi. He has a hernia. And then there's a guy from Bolivia who has doesn't say. And then there's this girl from Cambodia. What does she have? Torn Star. Yo, she started funding at August 5 and no one funded her yet. Oh, she has cataract. Oh. So, she needs cataract surgery? Oh, wait. She has cataract in her left eye. Okay, so she needs cataract surgery. She needs phacoemulsification cataract surgery. Thanks for seeing. Wish you best. Sorry, this is as far as I can go. Okay, Seiki, thank you for stopping by. Yeah, we have cataract. Well, there's more here. So we got from Uganda. This one needs... What does she need? She needs a C-section? Oh, wait, this is weird. She is scheduled on September 11th, but hasn't been funded. Oh, I think I get it. I think what happens is they fund her surgery, and then I think it's reimbursed by donors. I see. Because this one is a C-section. Imagine needing funds for a C-section. Well, there's another Cambodia. Oh, there's a lot of Cambodian patients on here. Lisa is an 8-year-old girl from Cambodia, from Phnom Penh. What does she have? She has been experiencing nosebleeds, sore throat, and difficulty swallowing. Oh, she has enlarged tonsils and adenoids. Oh, she needs tonsillectomy. Cambodia mentioned. Yeah, apparently there's another one. There's a lot of Cambodians on this that need help also. There's a lot. Alright, so I think that's all. We can keep this short because I think I fried everyone's brains. I think I fried everyone's brains with everything here. That was a lot of patients and a lot of cases. So we mostly talked about breast, cancer, thyroid, cholecystectomy, hernia, hemorrhoids. Yeah, those are the most common ones. Apparently there is no patient here that has like colon cancer or Something like that. It's a good study for me. Okay, that's good. I hope you guys learned some stuff. And I think we're good for today. Because usually when I do medical education streams, I don't want to take too long. I usually do it short, or at least an hour, hour and a half. It's a good refresher for us. Okay, that's good. Okay, so tomorrow stream will be in Twitch. Okay, yeah, tomorrow's stream will be on Twitch. It's community games. I'll make a tweet about it. We're gonna do community games, so I don't know what games you guys want to play. Maybe I'll be playing with viewers. Maybe Jackbox. Do I have a Jack? Wait, is there a... I can buy a new Jackbox game. Let's see. I think I have... If there is a Jackbox game that is on sale, I will get it. Jackbox. Party Pack. Search. Oh, there is none on sale. Wait, was the sale over or they just didn't go on sale? Would be good to line up the games so as viewers can... Yeah, I will see. Oh, shoot. Yeah, apparently Jackbox games are not on sale. I thought they would be. But no. I only have one type of Jackbox game, I think. We can do that. The Jackbox game I have is, 7. Party Pack 7. Yeah, we can still do it. We haven't played this in a while. I'm gonna see what else, what other games we can play. Is there like a... Oh, I know. We can do crab. You guys remember Crab Game? Was there an update to this? Oh my god, look at this. I looked at Crab Game and there's like freaking 52 people on my list that's all that has the game and has played it. Is there another similar game to this? Wait, that's cheap. Crab. Yo, there's a Crab Game too. Is this serious? There's a Crab Game too, yo. But the reviews are negative. Mostly negative. Why? Let's see. This is a disgrace to be called Crab Game 2. The guy made a worse version of Crab Game, then proceeded to charge money for it. Reviews. It's really bad. Just don't bother. The original hasn't been updated for 2 years and is still far superior. Not to mention this is a sequel in name only. It's not the same publisher in any way. Okay. I would join your Twitch chat, but Twitch still hasn't fixed their Twitch phone number verification thing. Oh yeah. Oh, you know what? The phone number verification thing. There is a way to fix that, but you would have to get the Authy app. I use it now because I get that problem too. Because you know, like for example, here on when I'm streaming and I switch to YouTube, I would have to log back onto Twitch, or if I'm using some extensions where I have to log into Twitch, I get that problem, and I don't know why it's like that. Freaking Twitch doesn't fix their verification system. But I use Authy, and it basically resolves all my problems. You just have to keep logging on, like, verifying your Twitch. 2FA. Yeah, you have to just keep trying until you get it. That's the only thing you can do. And once you get it, once you're able to get that, get Authy. Just get it and leave it on your phone. It's a small app anyway. Put it in some folder, like put it in some folder on your phone or some corner in your phone and leave it there, so that when you try logging onto Twitch, just open Authy and then you can just put the code. Because sometimes that SMS code thing doesn't pop up. Even I get that problem. That's why I had that problem before. Like how many days I couldn't log onto Twitch. That was like years ago. How many days I couldn't log onto Twitch so I couldn't stream. I just decided to get Authy because it pissed me off. Yeah. It's a pain, I understand, you guys. I went through that. It's stupid verification, 2FA, and even the SMS code thing was annoying. It was annoying as fuck. That's why I ended up getting off, because it pissed me off so much. Ends up in marbles. Bakari, come to think of it, I have not played marbles with you guys for quite a while. Marbles on stream. We have not played that in a while, no? I'm gonna look for some. We can play. Wait. Have that same problem. I did try that, but it didn't work. Yeah, you know what? You have to. I know someone had the same problem, and he consulted me. It was another Tekken player. He had that problem. He asked me, and I was like, just keep trying. And then once you get that SMS code and you're able to verify and everything, get Authy. Just get it and link it to your Twitch, and you're good. You will have no problems anymore. So just keep trying, and then once you're in, then just get Authy app and then keep it on your phone. Doc, I miss marbles. I keep it. Okay, we can do marbles. You guys want to do marbles? Anyway, we'll do. I will, the community games will last for, maybe we'll do it until next week, because, like I said, tomorrow will be, some random game with the community, I don't know yet, and then Friday is Tekken 8 with viewers, so whoever plays Tekken 8 can play, we can play and fight each other and beat each other up, and then, what else? I need like a game where you can put like 25 people in it. Crab game is one of them. Is there another game that's like this, like freaking... I used to Google Authy. Oh yeah, that one. But I think Twitch uses Authy, so... Authy is for... You have to get Authy for Twitch. Oh, I remembered something. There is a game I have. I remember I had a game here where... Oh yeah! I remember I had a game where the chat on Twitch... here it is, Choice Chamber. I remember this game. It's like a platform game, and then the chat can like choose stuff for me. I don't remember how far I went in this game, because I remember when I played this, chat kept choosing weird stuff. I remember this. Choice chamber. Yeah, the one with the Twitch extension. I know that, like it has a Twitch extension, and the Twitch chat can like freaking mess you up in this game. Yeah, I know there's one. Let's see, Twitch. What the hell? I typed in Twitch on the search bar of Steam, and then one of the things that came out is like, it says here, dream girlfriend Twitch thought. And then if you look at the user tags, it says here visual novel, hentai, dating sim, satire, NSFW. It is 71 pesos. What the hell? Oh hey, they're gonna have the tits here on Steam. Chat TDD, TDT, Tower Defense Twitch. Wait, what is this? Is this like the chat can choose? Tower Defense Twitch. Your Twitch chat becomes an integral part of the action. What do they do? Decide. Okay, la la la. Wait, what does it do? What do you do? Viewers vote map. Let your audience have a say in the game. Viewers can vote on the next map, adding an extra layer of excitement. Okay, what do they do? Oh, it's a tower defense. What does the Twitch chat do? Kokoro? Oh wait, I think I have that. Kokoro? I think I have that. I think I have that. I never touched it though. I think I was given Kokoro stream chat game. Here we go. Yeah, I got it. Ooh, yeah, we could try this. What do you do here? I have it, but I don't know what. Oh my god, it looks cute though. Okay, Kokoro. Collection of 20 plus games with 2D shooters to tackle. Oh, we can do this! Let's do this tomorrow! Okay, we'll do this tomorrow. Let's do Kokoro. Typing Kokoro will save a place for you in the... Okay, wait. Oh, here we go. There's a chat here. So what do you get? There's mini-games in chat. So there's action, cooperation, strategy, investigation, roleplay. Sociological skill versus stream. Oh. It looks funny also, it looks cute. Disconnect your Twitch and let chat do all the playing. Ooh, okay. Okay, let's try that. Yeah, let's try it. I'm gonna download it. I have it already, but I never touched it. I'll install it right now. Mini game up to 1,000 players. Wow. So everybody can do it. That is interesting. There we go. I downloaded it. Let's try it. Yeah, let's try it. Let's see. Let's look for other multiplayer. Or like party games or something. Party games. my god, there's Among Us 3D VR. That's for VR users. Saying Jackbox Party, it's not on sale. Unfortunately. Oh, there's like a Lego party game, but it's expensive. It's 1,000. You know what? Party animals. I have party animals, but it's expensive. 750. So if you don't have it, a lot of party games are expensive. Online party game of drawing and guess. Draw and guess. Oh my god, this is pretty much like Gartic Phone. This is pretty much Gartic Phone. Oh my god, Pico Park. Hello, Strudel. Common surgery's PH Gulit. Zigger Zank. Hello, Duck. Can surgery mend a broken heart? My saliva can. Uma Musume party game. If you want me to play Uma Musume, you have to get the goal. Okay, let's see, guys. Since someone donated $10 today, we got, this is our thing so far. Our, Donothon. Alright, so, we are at 1,000 US dollars. Oh! Oh, thank you for the dono partially. Yay, thank you for the 25. Okay, so what does that make? 1,197 US dollars. We are like 100, no, less than 100. Mga 50, $60 away from solo repo. Because we already passed 1,000, so like only 60 $60 or so for solo repo. Nice. If only Jackbox was. Yeah, I know, right? Jackbox is so expensive. Anyway, yeah, we're almost at solo repo, and then 1-5 will be Konyo Speak for 30 minutes. I'm going to, at the end of the week, I'm going to make an update on the Donothon goal. So maybe on Saturday, I'll just post the new updated goals. I'll just cross out the ones that are done. So we're very close to solo repo. And then the next one is Konyo Speak for 30 minutes. And then Super Spicy Ramen. $2,000 to activate. $2,000 for me to turn into a man. Sorry, I just can't with your Twitter PFP Sure. Yeah, that's what happens when I give you guys too much power, okay? Chat picks my PFP and my banner. You know what? And my tweet. Come on. That is actually one of these are the easiest things to reach because they're always at the beginning of a Donothon. Like they give them power at the beginning of the Donothon. Turn you into a man. Are you a man, IRL? Well, my VTuber is a woman, so turn me into a man. And then at 250, you guys, I'll set up a stream where I'm gonna rate your bathrooms, your nasty bathrooms, okay? And then 500 is when we start with the ASMR. Don't worry, you stand out on our Twitter. I know. I think some people don't take me. I think people, when I tweet something, people aren't taking me seriously because of the PFP, man. because of that PFP, I had to like change my name. I had to change my name to include the Wsfp Donathon, or else people will be wondering like, why the hell is ShioriPon with a PH avatar? So I have to put that. My name now has the Donathon written on it, so they know that I am doing a Donathon, and I was forced to change my name. How's the iced coffee? Nasty. Coffee's disgusting. Especially that one karaoke. Which one? The jumbo hot dog or the bulaklak? Hopefully we can reach 10,000. I hope we can reach 10,000, guys. I think we're doing good for the first week. Hopefully we can get the goal, guys. Just remember, share and tell your friends and other people that we're having a Donathon to help patients who need funds for their surgeries. When you move like a fly. Okay. Just spread the word, guys. Spread the word for the Donathon. This is the largest Donathon I've ever organized. It is the largest, and I hope we can reach the goal. Alright, wait, close this. Alright, so I think we're good. We are good, I guess, I think. Wsfp, guys. Can I still suggest a PFP for X? No, it's already done. I already changed it to the PH thing. It is done. Reseta ni Doc, share the links. Yeah, share the links, guys. Share the Donathon. Let people know that I'm doing a Donathon. Scatter it. Anyway, we are done. Let's go raid somebody, or let's go I'm gonna redirect to someone. How do I do that? Oh, let's see who we can go to. Redirect. Who can I redirect to? Oh, let's redirect to wait. Who's this? There's a bunch of people I can redirect to. Okay, I can redirect to Horori. Let's go to Horori. Let's go redirect her. Horori. We'll go to Horori. I have not redirected to her before. Alright, guys. Wsfp, thank you guys for coming to my stream, and I hope you guys learned a lot. I think I fried some of your brains. But thank you anyway. And I'll see you guys tomorrow on Twitch. Thank you, Atsu. And spread the word about the Donathon, guys. Spread the word. Bye-bye.